Perfect. Okay. So nice to chat with you today. So I could tell you, I could introduce you and have a great information about your bio, but I want you to tell me about you. I think it's much better if you tell me who you are. Why are you so passionate about dermatology? Why are you passionate about lifestyle medicine, really? Because that's not what all dermatologists do. What is it that kind of drives you? What are your passions?
All right. Well, thank you for the opportunity to be on the podcast. So my name is Dr. Kemmy, and I'm originally from Kenya. I actually grew up in Nairobi, and I moved to the U.S. When I was 19 to start college. So growing up in Kenya, it was kind of an environment where women were told were told that their expectations were that they were supposed to be good wives and mothers, and they weren't supposed to have big dreams and dream a lot. So every time I told people I wanted to be a doctor, people scoffed at me, and there was a lot of discouragement along the journey. But my parents were my biggest role models, and they kept on telling me to push myself forward, to go forward. I also got help from a lot of books. So I'm a big fan of reading. I love reading. And so I read the book Think Big, and that book just really changed me. It made me want to come to the US and want to go to Yale specifically. So when I was in high school, I worked really, really hard at school, learned about what it took to get to the US. So I took my SATs, everything. I was able to get into Yale for undergrad. So I did undergrad at Yale, though 4 amazing years. And then I also did medical school at Yale, internship at Mass General. And then I was very fortunate to do my residency in dermatology at UCSF. So all of that was great. And when I was done, I became a general dermatologist. And then of all places, I moved from San Francisco to East Tennessee, to a small town called Maryville in East Tennessee, because at that time, my husband was doing his residency in Knoxville. So, instead of joining a group of dermatologists, I chose the challenge of joining a multi-specialty group that didn't have a dermatology department. And it served a lot of rural populations, people from Appalachia. So I did that, started the dermatology department there, and it was just really great. I was exposed to Southern culture, people from all walks of life, all types of skin disease. And, as I was doing that, I loved all aspects of it. But then I realized that at some point I was telling my patients the same thing. I was giving them the medical treatments, the dermatologic treatments that we typically give people. But I realized that their lifestyle also played a big role in their conditions, especially stress. Stress was a big factor for many of my patients. Whenever I had a patient with well-controlled acne or well-controlled psoriasis and they were having a flare, a lot of times stress was one of the biggest things causing the flare. So stress management is something that I found myself doing a lot and talking a lot about. And then also diet and how it affects disease and their health, exercise, getting enough sleep. So even without knowing I was practicing lifestyle medicine, I started incorporating that into my dermatologic practice.
Yeah, and it is so important to talk about prevention, right? I mean, that's really what you're doing. You're saying let's optimize what we're doing, but also let's not end up back where we are. And it's so much that we don't get that much in medical school to really talk about how those lifestyle factors play into our health, for sure. Your parents must be so proud of you. You're quite an accomplishment. It's amazing.
And they've been amazing. I mean, they were my role models and the people propelling me to go forward, because again, society just kept holding women back, but they were like, you go do everything. Just go for it. The sky is the limit.
Yeah, you need good advocates in your corner for sure.
Absolutely.
So how have you seen dermatology change to where more dermatologists are interested in how can we change, not just necessarily prescribe medication, but what can we do to improve someone's outcome and whatever, skin disease that they have? What are the changes that we can make in our life to change that?
So I think there's an increasing number of dermatologists who are focusing on that. And, as more and more of us are focusing on that, focusing on things like the microbiome, there's more research coming on it. And I think as the dermatologists, many of them are still not yet on the bandwagon, but I think as more research comes out and as there's more evidence, then that will become more the standard of care. So it's growing. We're growing in number.
Yeah, I think what you said is actually key. Gut microbiome, that's really, I think, the data that's coming out with how it's linked to depression, mental health, how it's linked to skin health, how it's linked to hormones. I think all of us in the medical world are kind of going, wait a minute, we didn't really take much into fact what happens in our gut really affects our whole body. So I think you're right that it's really, as that information comes out, all of us have to look, right? We have to see and
We have
say,
to look, yeah, because I mean, we are evidence-based, and I love the fact that in medicine we follow the evidence. It's just unfortunate that the evidence on gut health took too long to come, because I think we always had a hunch on lifestyle affecting it, but it's really difficult to do research and to have good studies that really show a link, just because people are complicated and it's hard to do those studies. But it's exciting that more and more of them are coming out. So it's exciting to see the direction medicine is changing, and the fact that we'll move more towards wellness instead of just disease management.
yes, for sure. So do you have stories of like transformations that have happened with your patients who have taken into account their lifestyle and what small changes they can make in their lifestyle that have affected their disease? Do you
Oh,
mind telling us
absolutely.
that story?
Yeah, absolutely. I love stories. Yeah, so I have a patient who had really difficult acne. She was in her 30s, and her acne was just very difficult to control. She'd bounce around from dermatologist to dermatologist, and she'd been given medicine. She'd even gone through isotretinoin, Accutane, and it worked for her for a while. But then she resorted back to having really difficult to control acne. And so, when I reviewed her medical history and found out that she'd taken pretty much, she'd taken most of the topicals we recommend. She'd been through spironolactone. She'd now taken isotretinoin, and she was still not doing very well. I decided to just dig in some more. So I asked about her lifestyle. She had a really stressful lifestyle. First of all, she was a smoker. She wasn't sleeping well, a lot of high stress. Her diet, because she was so busy, it was an on-the-go diet, either eating at restaurants or fast food, lots of sodas, lots of caffeine. So, I mean, she was a bit more of an extreme case because she wasn't really taking good care of herself. But once we addressed the lifestyle, once we were able to, get rid of the excessive sugar, no more sodas, we were able to transition her from the processed foods she was eating to more plant-based foods that were more whole foods. She was able to control her stress, cut back on her smoking. Her acne really changed. I mean, she was transformational. And, many other patients haven't had the transformation that she had, but she just lost a lot of weight. Her acne became better controlled. She was a happier, healthier person. So she would be my one story of how acne changed, and just how lifestyle changes really, really played a role in somebody in whom we had tried a lot of the medical management that we have out there.
Well, and you transform her life. Now she's not smoking. So now you've long-term have helped her decrease her risk for a lot of things, including cancer. So you've transformed her life in other ways as well.
Absolutely, absolutely. She's one of my true success stories. And there've been others with psoriasis who would have gone on to biologics. And as you know, the biologics in psoriasis are very effective, but they can also be really expensive. Some of the drugs cost about $50,000 a year. So she was able to control her stress and just focus on aspects of her lifestyle and get to the point where we could manage her with topicals and not have to go the biologics route. And again, I love biologics. They're wonderful, but if we can do without them, it's better, because some of them will give patients free medication for 2 years, and then after the 2 years they're like stuck with having to pay thousands per month to get their medicine if the insurance doesn't cover it. So
sure. And if you can not use medication, right, isn't it better? Ultimately,
exactly,
not to
much, much better.
Everybody wants to be not dependent on medication forever. So I think I see that frequently. Women will be on Accutane and kind of get off and they're right back to where they were because the underlying cause was not addressed, whatever it is. If it's lifestyle, if it's sleep, if it's smoking, if it's, poor diet, if it's, drinking too much alcohol, whatever it is that's causing their underlying reason for their acne, then if it's not addressed, then ultimately they end up right back where they are, even if we use really good medications that work.
Absolutely.
So I work with a lot of women who have hormone issues or PCOS, or both basically. And so a lot of times, obviously, acne comes into play. Aging comes into play. And so we talk a lot about in my coaching programs and in my clinic about how what you eat affects, your skin and your skin health. So for PCOS patients specifically, do you have certain tips or tricks that you have for women who are sort of have that underlying hormonal issue that's causing a lot of their problems?
So PCOS is super tricky to manage. Again, it really goes back to lifestyle, and it's easier said than done. So a lot of them tend to be overweight, and one of the most important things is weight loss if they can do it. A lot of times the patients want immediate results, and they know the weight loss will take a long while, especially if it's done in a healthy way. But I really try to encourage weight loss and everything that it'll take to do weight loss, whether for some people it's intermittent fasting, and whether it's just making the small changes. It's the small changes that I like to focus on, especially because for me, since I'm not coaching them, I have that really short window. But in general, what I'd say is do whatever you can to lose weight. We all know what it takes to lose weight. Sometimes it's motivation that you need, sometimes it's coaching that you need, but we all know that we need to eat more whole foods as opposed to the processed foods. So, a way to think of whole foods just the way Mother Nature gave it, or you can think of foods that 100 years ago they were eating, because many years ago they weren't processing foods. So for sure, whole food diet, lots of fruits and vegetables, drinking lots of water, and replacing their beverages like their juices and their sodas with water. I'd say for sure avoiding sugars and high glycemic index foods if they can, making sure that they're switching their unhealthy fats for the more healthy fats. And in general, the plant-based fats tend to be healthier. So a lot of those tips when it comes to diet, and then exercise as much as possible, get your sleep, try to get your full sleep, your full 7 hours of sleep. I know in our busy world it's hard to, but it's really, really important. And then just doing whatever they can to control stress. And stress control is such a complex topic. It's a big topic in and of itself.
Yeah, and women with PCOS often suffer from not only acne, but hair growth, excess hair growth on their, chin and belly. And do you, because, nowadays I think more women are focused on natural approaches or natural solutions instead of electrolysis or other options. Do you have any tips for sort of some natural solutions for the hair growth, or do you think there's just medications that work a little bit better, or what is your opinion on that?
So when it comes to the hirsutism, I like relying on the technology that we have. So I think for people who have excessive hair growth, I like electrolysis and laser hair removal. And now that the lasers are advanced, we actually have lasers that work for more skin tones. The older lasers were better for lighter skinned people, and they were really ideal for lighter skinned people who had darker hair. But now our lasers have gotten to the point where they can treat darker skin, and they're so much safer. So even though it's expensive, I like that. You could still do the traditional plaquing. Waxing, I'm not a big fan of because I feel like it damages the skin some more. But in terms of excessive hair, I think we try to do our best to control our insulin levels, make sure they're not so high. Go with those approaches. Yeah, the natural stuff, I'm not really sure that it works that well. So I just like to go with what we have right now.
I'm really glad that you said that about electrolysis. I think that's really important for women who, don't have all the same skin tones, who have darker skin tones, that there are less side effects from these new lasers. I mean, they're amazing anyway, what we can do in very quick and short procedures. And it's amazing that they've really advanced it to be able to address all skin tones. That's great.
Yes, no, it's really exciting. And, the thing, though, is that the lasers are expensive. So you will make unfortunately, a lot of research has to be done so that you can actually go to a place that has many lasers and actually has the device that you need. So I would just say people don't just go to anyone because they say they do laser hair removal. Do your research, especially if you have darker skin.
So are there particular things that women should look for in a practice? Like if they're looking to make sure that it's the right fit, is there like questions they should ask, or should they?
Yes, for sure. So especially if you have darker skin like mine, you want to ask them if they have experience treating people with your skin tone. Ask them what lasers they have and if the lasers are safe for the skin tone. Ask for before, after pictures. It's always better to go to a facility that has a board certified dermatologist or even a plastic surgeon even doing it, make sure there's a physician on site, because again, there are many med spas that have some remote psychiatrist managing them, and I'm not knocking them down, but I'm just saying, if you have more complicated skin, you want to make sure that you're in a place where people know what they're doing and where people can manage any complications that might arise. And then also with darker skin, we tend to have post-inflammatory hyperpigmentation that can arise when you have laser procedures and heat. So you'll need to also be sure you're going to somebody who knows how to manage that, and somebody who may pre-treat your skin with topicals, with topical creams, or at least give you the precautions to follow. So it's a little more complicated if people have darker skin tones.
Those are excellent tips. Thank you so much for bringing that up, because I think that's important, that women who often feel a little bit like, where do I start? And how do I know if this place is good for me or the right fit? And I think that's really important that you said before and after pictures to see, like, what are their changes? I mean, obviously, if you have darker skin and every picture is someone who's really fair skinned, it's probably not the right fit, that they don't have the experience that they're touting that they have. And certainly, I think in a lot of different fields, even in medi spas that do things related to gynecology, it's important that you have a physician that's there in case things do go wrong, and that they can give you the options of, how do we correct this? How do we fix what may not be the normal result that you're expecting?
Absolutely. Yeah, because I just feel like left, right, and center. And again, I just say to people, just know your healthcare providers, and know that board certified physicians have the highest level of training. I mean, I don't want to go down that pathway to talk about differences in training, but there's really a big difference between, nurse practitioners and physician's assistants versus physicians. And again, I don't really want to go into there, but patients should just try to know the differences so that they can make sure they're getting the care they need, and complications can be managed with the people who have the best training.
Yeah, and don't be afraid to ask. Don't be afraid to ask the question, because I don't get offended when people ask questions about where I'm from and what my training is. It's okay. I want to be a fit for them, and they need to be a fit for me. So that's okay, as long as, just don't be afraid to ask those questions.
Absolutely.
So I know you focus a lot about healthy aging skin and I hate the word anti-aging, because I just feel like we all age. So maybe like aging graceful, because we're all going to age. There's no way we can't. It's just a matter of, how do you want to age and how do you want to feel as you age? And I know you have a book coming out in November. So do you mind telling us about that book?
Absolutely. So the book is called Live and Look Younger, a Dermatologist's Guide to Youthful Skin and Ageless Beauty. And again, I didn't say anti-aging because I also hate that term, but it's pretty much for people who just want to look their best and prevent premature aging. And so the book has many sections. In the first section, it covers how the skin ages, and then it also talks about the intrinsic causes of aging, which are inevitable, and then the extrinsic causes of aging, those we can control ourselves. So I go on ahead and talk about ultraviolet radiation, and how it's one of the major causes of aging, and how we must do our best to sun protect. And then I talk about oxidative stress from free radicals in our lives. I talk about glycation, and really how it's really, really important, again, to eat that whole food diet and eat foods with a low glycemic index so that you're not prematurely aging. And then inflammation is a big thing. So then the book goes also into the lifestyle strategies that we can use to counter aging, like nutrition, proper rest and sleep, exercise, stress control, and habits. The book talks about different skincare regimens and the different anti-aging ingredients. Well, I hate to use the word anti-aging, but I'll call them that now, because that's how you'll find them. So it goes into that, and then also talks about cosmetic procedures. So it's pretty much your ultimate comprehensive guide on how you can keep your skin looking younger. And it ends with a lot of affirmations and some mindset work, because we also have to transform our mindset to become healthier people and the best versions of ourselves. It's not just what we do, but it's different levels. It first starts in the mind as the innermost level, and then the way we take care of our bodies, and then the external is the outer layer. It's the cosmetic layer, and it's not what we really should be focusing on, even though people really like to focus on that primarily.
That is so, so, so true. It's really about how you feel about yourself and how you feel about your body and how you feel about looking in the mirror. I mean, I think so much of the anti-aging stuff that's in our culture is superficial, right? It's about, do I have no wrinkles? Will people see me with the wrinkles? Will people see me with the misplaced hair or things that are just not? And it's like, really, if you are happy with who you are, if you've worked on that particular aspect, then you don't care if you have the wrinkles. If people see you with the wrinkles, that's okay. It means you smiled a lot in your life.
Exactly.
And you laughed a lot in your life, and that's okay. That's much better than being perfectly, perfect from the outside, I should say.
Absolutely. Absolutely.
So some women may not know what you mean by oxidative stress. Do you mind? I mean, you don't have to go into just sort of a basic understanding. What do you mean by oxidative stress?
So pretty much by oxidative stress, I just mean that there's certain things like free radicals that stress out the cells in the body on a cellular level. And so, and there are many things that we're exposed to. So again, for me, from the skin perspective, the ultraviolet rays from the sun, they're great, and they allow the skin to synthesize vitamin D. But unfortunately, they damage the DNA and they cause the skin to be stressed out. We also have things like pollution that stresses out the skin. Sometimes when hormonal changes, inflammation stresses out the skin. So all of that oxidative stress it wears on the body, on the cells. It damages the DNA. It causes the telomeres, which are the ends of your DNA, to shorten. And so all of that oxidative stress pretty much accelerates the process of aging. And that oxidative stress is fought by antioxidants. And that's why you'll see people talking a lot about antioxidants and taking them in your diet. I know, unfortunately, the supplements world is full of all these antioxidants that people should take, whether it's turmeric pills or CoQ10 pills, although we can get them from our diet, and that's the best place to get them. And then in skincare, there are also lots of topical antioxidants that you can put to help your skin out and to help fight the effects of the ultraviolet radiation. So hopefully that answered things a little bit.
Yeah. So, and when you're saying that, it makes me think of sort of all the options over the counter, like all the things that people can take. And I'm sure you have pet peeves about things that people take or find over the counter that's misinformation or things that they should be thinking about. Are there any particular things that you counsel your patients about, like avoiding in general, that as far as skincare products?
For skincare products, I'd say avoid products that have a lot of big claims. So, like if they say instantly does things in 1 week, sometimes a lot of the big claims are just marketing. So avoid those. I tend to be more conservative, so I'm excited when new things come into the market, whether it's peptides or the CBDs. But I just say, you know what? We also have things that are tried and tested that are older, like retinoids. I'm a big fan of retinoids. They've been around since the 1950s, and we have lots of data to show how effective they are. So I would say stick with things that we know are effective. Stick with retinoids that work well. For many, I'd say for women over 35 and up, when you're in that perimenopausal period, you know that when menopause comes, you're going to lose 30% of your collagen. So you may as well start with your retinoids now. They work, they stimulate collagen production, and if they're used in the right way, they can really help the skin. Other things like vitamin C have a lot of data backing them. Niacinamide is vitamin B3. It has a lot of data backing it. So I'd say, there's a lot of stuff out there that has data backing it that works well. And just stick with the basics. You don't have to go chasing after the new things like topical collagens, which, by the way, will not be absorbed by your skin, and peptides. It's always a fad to chase after the next thing. Stick with the basics, and then also take care of yourself from the inside out, because part of the reason why you might be chasing all these topicals is because you're trying to look for shortcuts and you're not doing the homework to start from the inside out. Because true beauty, and if you want to glow, it always starts from your lifestyle and things that you do from the inside.
So it sounds like you prefer like non-serum kind of options, but more, taking the food in that you need and the nutrients you need, but not necessarily those. Because I know a lot of anti-aging stuff over the counter focuses on the serums with the vitamin C and all kinds of peptides and all these things that you can get to put on your skin. So those things it sounds like those are not your things that you promote.
No, I like them too. I
Okay.
think it should be a mixed approach. I think we should work from the outside in and the inside out. I just think, especially when it comes to things like serums, they're wonderful, but most people probably need some guidance so that they can get the serums that work for them. I also think that a lot of people will buy things either because a salesperson got to them or because their sister or their friend used it. Everyone's skin is different. So, for example, like there's one dermatologist in Florida, Dr. Leslie Bauman, who came up with skin types, and there's 16 different skin types. And so what will work for one skin type will not work for another. So I'm a big fan of more information and personalizing things to yourself, knowing what works for you and using what works for you. But I'm still a big fan of skincare products and serums. Just use the right things and don't go with the flow, and don't use products just because a magazine said so. Make sure that things work for you. And the reason why I'm a big fan of lifestyle is because we know those lifestyle changes work for everyone. They don't have to be customized for you. We know that getting adequate sleep and proper sleep hygiene benefits 100% of people. We know that eating a healthy diet benefits 100% of people. So I love the lifestyle changes because they work if they can be implemented in your life.
And they work across all areas, not just they fix your hormones.
Yes.
They fix your skin. They improve your gut health. I mean, so it's working with throughout your body, as opposed to just saying, I'm going to have healthy, glowing, radiant skin. You're usually going to have pretty normal periods and also good digestion with it, calm digestion. So you're right. Lifestyle factors are much more important to focus on first than adding in other supplements or medications or things like that too.
Absolutely. But yeah, I think it should be a whole rounded approach. I think, even procedures like Botox and fillers, I do them. I'm a fan of them. I haven't had to have them yet, but when I'm 50 years old, maybe I'll have Botox in me and fillers. Who knows? I don't know. But I always want to start from the inside out. But I don't think there's anything wrong in getting help from cosmetic procedures and getting help from external things. But I think the focus should really be on the internal, and we should kind of stop the tendencies to have instant gratification and want things down now, whether it's cool sculpting to get rid of the fat that's been stubborn. Like, I think we should focus more on the long-term sustainable lifestyle changes, even though it's easier said than done.
Yes. That is perfect. That's exactly what I try to focus on. Long-term changes. There's a lot of quick fixes about how to fix your hormones quick and how to do this, but ultimately, a lot of times it ends up making you unhappy because you're back to where you were.
Absolutely.
As opposed to just going and doing the work, and then ultimately have these things as sort of added bonuses onto helping you feel better instead of quick fixes. So yeah,
I like that. Yeah, they should be added bonuses, and they're there to be added bonuses. So
yeah,
I love the approach you take.
I frequently talk about this is a marathon and not a sprint.
Absolutely.
The long game, especially with hormones, because unfortunately, as you age, your hormones change. You could be going pretty steady for a year or two, and then things kind of get a little crazy. So you have to kind of rein in the crazy a little bit when those things happen. So what does the future look like for you? What kind of avenues are you going to do? You're practicing dermatology or lifestyle medicine. Where do you see kind of your practice going in the future?
So in the future, I still love conventional dermatology, so I'm definitely going to keep practicing it and all aspects of it. But I also love lifestyle medicine, and I'm incorporating programs like coaching programs and courses, just a few other supplemental things to help people address these aspects of their lives. I'm inspired by doctors like you who do podcasts, and I'm toying around with the idea of starting my own podcast, the Live and Look Younger podcast. So that's something that might be coming forward in the future. But for now, I don't know if I mentioned, I happen to be on maternity leave. So right now I'm just enjoying time with the babies and, enjoying the additional things that I'm able to do on the side in addition to taking care of my baby. And, I know we're probably running out of time. We were going to talk about things for pregnant. We're going to talk about pregnancy and things that pregnant mothers can do. No, let's want to talk about this now.
Yes. I think it's really important because in that space, there's not a lot of professionals that talk about how do we think about our skin during pregnancy and postpartum. And I think, unfortunately, I think in that space, a lot of people just say, tough it out, you're pregnant, it'll be fine, and deal with it. And I think it's incredibly important women who are science behind, how do we, I'm so glad you brought that up. How do we really care for our skin during pregnancy and all the changes? And then what do we think about afterwards in the postpartum care? Because things get very different afterwards, other hormone levels that drop. And so how do we then still take care of our skin and a baby? So yeah, let's talk about some pregnancy changes that happen to our skin and what we can do to sort of, make our skin healthy during that time.
So yeah, during pregnancy, the levels of hormones, estrogen and progesterone go high. And so, depending on it's very unpredictable. Different people have different levels as they rise. So, some women are lucky that they have the glow of pregnancy.
Mm-hmm.
For those women, they tend to have a little bit more estrogen dominance, because estrogen, when it comes to the skin, I feel like estrogen is one of them. It's the youthful skin hormone. It's good for stimulating collagen production, elastin, hyaluronic acid. And so if you're pregnant and you have higher levels of estrogen, then you'll have that natural glow, and you may not have to do too much extra to look good. Sometimes though, progesterone tends to be too high, and with the progesterone comes more sebum production, so you tend to have more acne, and then your skin can also be more swollen. So instead of having that lovely glow that people want in pregnancy, instead you're having swollen, puffy skin. For some people also, the estrogen and progesterone levels go so high that they start stimulating melanin production, and so people have chloasma or melasma, the mask of pregnancy, where there's hyperpigmentation on the cheeks, on the forehead. So in general, in terms of what you can do to have more glowing skin in pregnancy, I'd say one of the most important things is sun protection, because your hormone levels are going to go up, and everyone is at risk for chloasma or melasma, although some people have it more than others. But pretty much about 50% of pregnant women have it to some degree. So sun protection is one of the most important things, so that you don't have the UV radiation stimulating those melanocytes. And I'd say use a broad spectrum sunscreen that has UVA and UVB protection. If you're worried about the chemicals in sunscreen, then you should use the physical sunscreens that have zinc oxide and titanium dioxide. So again, the stand of the American Academy of Dermatology is that the chemical sunscreens are safe, but I know there's been some controversy, and there have been some studies that show that there are levels of those chemicals in the bloodstream. And of course, if you have a growing fetus, you don't want that. So that's why I'm emphasizing the physical sunscreens with zinc oxide and titanium dioxide. And then I'd say keep on cleansing your skin well. A lot of times we're so tired in pregnancy, some people fall asleep with their makeup on or without washing their faces. Please, please, please be sure that you just have it in your regimen. Cleanse with a nice gentle cleanser that works for your skin type, just to get rid of all the dirt and the grime that accumulated during the day, because as boring as cleansing sounds, it's really a really important step. And then you want to moisturize really well. And even if you have acne, there are some moisturizers for oily skin that help you, because if you don't moisturize because you're having acne, the skin will know that it's dry, and it will produce more sebum to counteract that. So you'll want to moisturize with the right type of moisturizers that will keep that balance going. And then, pretty much as far as acne treatments go, there are many that can't be used in pregnancy, but we still have some like isolaic acid that can be used. You can exfoliate with things like glycolic acid to get rid of those top layers of skin and give yourself a glow. So there's still some treatments that can be used in pregnancy, and you don't just have to tough it out. And then, in pregnancy, we're told people think they're eating for two, so they eat everything, anything and everything. Just still be careful, because even if you have that glow, just be careful with what you're eating. It can still affect your skin. So pretty much those are my tips. Make sure you're getting sleep, even in the third trimester when it's really hard to sleep, because the sleep will help with your glow, and make sure you're hydrating yourself adequately. Hopefully this has been helpful.
Yes, it's been fantastic. Yes, those tips are great. I think the only thing else I would add to that is just sometimes things change, like the cleansing gels you used before don't always work during pregnancy because your skin does change a little bit. So be open to the idea you might have to do a more gentle cleanse than cleanser type than you're used to, or you might have to change it up a little bit, because sometimes just the way that your hormones change, you have to change products, and that's okay.
Absolutely. Absolutely.
And postpartum, the drop in hormone levels doesn't help either, especially with women who are prone to acne. That really and they're not on hormones afterwards. They're not going right back to their birth control pill. So a lot of times your acne gets much worse postpartum. And clearly the stress is super high.
Absolutely.
And you can't help that part. You do your best, but a baby and infant is stressful. So do you have some tips for women who are postpartum?
Oh, yeah. So at least thankfully in the postpartum period, there's a lot more that you can use. If you're not breastfeeding your child, you can go to using topical retinoids, and they help a lot with acne. For breastfeeding people, it's controversial. I'd say still stay away from the retinoids, but I know there's some people who use them. If you have to use them more sparingly. There are medicines like azelaic acid that are safe for pregnancy and in the postpartum period, so definitely make sure you're using them. You can go to your skin peels like the glycolic acid peels. Make sure that your your moisturizer is more nourishing, because as you said, the hormone levels have dropped. Your estrogen level has dropped down, so now your skin is drier and it's not holding on to moisture well. So you may have to buff up your moisturizer use. I'd say now that the baby is out of the system, you can do a lot more antioxidants. For sure, you should be using products with vitamin C, vitamin E. Some ferulic is good. Green teas are good antioxidants. Just things to help your skin out a little bit. Hyaluronic acid is great for the skin. Ceramides are great to just keep it hydrated. And I know it's hard to get your sleep, but I can't just overemphasize how you want to maybe simplify your life as much as you can and try to get your sleep as best as you can. Try to eat the healthiest meals you can, even though there's not that much time for meal prep. And if it means signing up for a meal prep service like HelloFresh or all the ones that are available there, sometimes it's worth it for you just to make your life easier, so that you're not tempted to drive to a fast food place or to drive to restaurants and eat restaurant food all the time, because as delicious as restaurant food is, you know that it has a lot of salt, a lot of fats, and they might not be in the most healthy way. So just try your best to do it at home if you can.
Yeah, reach out to your family, see if they can help you with meal prep. That's
absolutely.
Yeah, you're and restoring your hormones back to normal naturally also involves sort of continuing to eat healthy and continuing to provide the right nutrients so that you can breastfeed as well, that you're giving the proper nutrients to your kiddo, your baby.
Absolutely.
So that's important to get back into that regular routine of doing eating healthy and preparing your own food. So yeah. Well, thank you so much for all of your great tips. How can people find you if they want to look you up?
All right, so if you'd like to look me up, you can find me on social media, Instagram and Facebook, with the handle at Dr. Kemmy MD. So it's at DR and then Kemmy. Think of the name Kenny, like Kenny Rogers, but replace the ends with an M. So DrKemmymyd. So that's where you'll find me more readily, or www.drkemmymd.com. But pretty much social media, you'll find me on Instagram and find me on Facebook. And those are the best ways to connect with me at present.
Perfect. And where can they find your book when it's released in November?
So the book will be on Amazon, but if you'd like some extra bonuses, if you go to the www.drkemmymd.com, you'll get a signed copy of the book and a few extra bonuses that you won't get if you go on Amazon.
That's great. I'm glad you said something. That way people can check you out, and that's great. Well, thank you so much, and I appreciate you taking time. I know you're on maternity leave, and I appreciate that you took time to talk to us today.
Oh, thank you for doing this. And again, thank you for all your amazing efforts. You're making a difference. It's great to see women rising and helping each other. And I'm just very happy about Well Women MD. I'm a big fan of the podcast. So thank you. Thank you for all you do.
Thank you.